Hi everyone, this is Dr. Simal Soin, founder and chief dermatologist at AAYNA Clinics. Today's topic is one of my favorites, non-surgical facelifts. Why are non-surgical facelifts so popular? What are they? Non-surgical facelifts, in my view, are a revolution in aesthetic medicine because they have catapulted it to a different level. अब क्या होते हैं non-surgical facelifts? Non-surgical facelift एक ट्रीटमेंट है जो कोई टेक्नोलॉजी के ज़रिए जैसे अल्ट्रासाउंड है, रेडियो फ्रीक्वेंसी है, उसको यूटिलाइज करके उसकी पावर को हार्नेस करके आपकी स्किन में ऐसी चेंजेस लाता है कोलेजन के थ्रू या टिश्यू में चेंजेस करने के थ्रू दैट वो आपको यूथफुल लगने लगता है और आपकी एज जैसे एज रिवर्सल, जैसे आप अगर 45 के हैं तो आप 40 के लगने लगेंगे, 55 के हैं तो 50, but the clock goes on still. So you start looking 50, but the clock goes on from that time. So it's actually wonderful treatments, but you must remember they are operator dependent. One does not equal the other. There are good techniques. Everything is also skill based. So let me talk about L therapy. I don't have a favorite and I'll tell you why. Because one size cannot fit all. Somebody might be a good candidate for L therapy, somebody might be good for Thamad, somebody might be good for XLS. HIFU comes in somewhere, although it's nice, but it's not my favorite because I don't think there's enough studies and understanding, and it's a general ultrasound which it's not like microfocus like L therapy, but fillers are again amazing. Also do the work of non-surgical skin tightening and lifting. तो ये 5 मोस्टली हैं. ऑल्सो एक और है जो हम कहते हैं आयना रिन्यू, जो कॉम्बिनेशन ऑफ माइक्रो नीडिंग एंड रेडियो फ्रीक्वेंसी है. सो बहुत टेक्नोलॉजीज हैं, बट दीज आर वेरी स्टैंडर्ड with AAYNA, with us, and globally they are the gold standard. So L therapy micro focused ultrasound है, good for the lower face and neck aging, बहुत अच्छे रिजल्ट थोड़े ब्रॉडर फेसेस के लिए, बट पतले फेसेस के लिए थमाज कई बार अच्छा होता है. थमाज फेस के लिए ही नहीं, आईज के लिए भी बहुत अच्छा होता है. तो वो आईज की स्किन टाइटनिंग नॉन सर्जिकल ब्लेफरोप्लास्टी करता है. देन वी हैव एक्सेलिस, ऑल्सो मोनोपोलर रेडियो फ्रीक्वेंसी लाइक थमाज, बट वो स्टैटिक नहीं है, मूवेबल है, तो उसमें मल्टीपल सेशंस चाहिए होते हैं. देन हाइफो इज ऑल्सो अल्ट्रासाउंड, बट उसका रिजल्ट 3 to 4 months से ज़्यादा नहीं लास्ट करता है. Fillers will be when you're doing lifting, you do it with the cannula. तो आप लिफ्ट करते हैं टिश्यूज को, उसको to simulate a surgical facelift जैसे आप कहते हैं, but through the use of fillers. तो बहुत सारे टेक्निक्स हैं, बट ऑब्वियसली आपको अपने डॉक्टर के पास जाके, अपने डर्मेटोलॉजिस्ट के पास जाके एक्सपर्ट एडवाइस लेना है. So are they safe? They are absolutely safe. They are very safe, but again you must remember in trained hands. अब ये कितनी देर लास्ट करते हैं? L therapy, Thamaj typically last for more than a year, can last up to 1.5 to 2 years, and आपको अपने आप पता लग जाएगा कि अच्छा अब मुझे लगता है कि मुझे ज़रूरत है. But they are so natural that I sometimes have patients who have been doing one Thamaj a year for many years, and I like to think that when I see them 15 years later, they look more contoured, rested, naturally younger, even better than they looked about 10-15 years back. Because आपकी collagen remodel होती रहती है, so it can only look better. Then XLS needs 1 session a month. You can keep doing it. It's very safe, very good, very uplifting, and it just improves your texture, and that monopolar radio frequency going to the face improves texture, does a lot of remodeling for you. And it can be done combined with a lot of facials. Then HIFO lasts for about 3 to 4 months. You will possibly need a repeat session every 3-4 months, and fillers again once a year. But lifting is usually done through the use of cannulas. I'm sure that आपको समझ आया होगा जो मैं समझा रही हूँ, but अगर आपको थोड़ी ज़्यादा information चाहिए, you want to understand more, please come, call us, book a consult with me, my team of doctors, and you'll be able to understand it through photographs and through making you understand what the technology involves, what your result will be, and how long it will last, and how often you will need to come after that. And we often do it for people. In fact, we have a lot of people who come abroad to do treatments with us. We have people from the US regularly coming once a year to do an nail therapy or a thermage. They're used to it. They like coming back to India and doing the treatments with us. So I hope you enjoyed listening to this. Look forward to seeing you all at AAYNA.